There's an imbalance of power between the hospital and the patient after a medical injury, no matter what that patient's demographics. But if that patient is harmed and in distress and or elderly, clearly they're not in a position, oftentimes following medical injury, to understand and process what questions need to be asked and what's right compensation and what's going to take care of them. And then you get into the part about the release, which is inevitably going to be part of a compensation when there's money involved. And that necessarily must be reviewed by a lawyer because it contains all kinds of provisions, such as confidentiality provisions sometimes, such as provisions that talk about liens and what the obligations of you, the patient, to pay back the liens are. And an attorney needs to educate the patient about that and oftentimes negotiate the liens. The spirit of this is to work with the healthcare provider, not turn it into some antagonistic adversarial process where cross-examination happens right from the beginning. I will tell you, I've had an experience, one so far, having gone through the care process. It happened very much like George said. I was invited to sit with the patient as she spoke to the surgeon that was involved in the medical error. The surgeon had his doctor there. I was able to ask questions. It wasn't in a cross-examination mode, but it was in an important way that the patient needed to know, why did this happen? How was I not told that I needed to have a pelvic ultrasound? Why did this escape everyone's attention? All that information came forward. Importantly, they talked about how they made changes. So this one happened to the next patient, which my client really needed to hear. And then we worked towards a resolution. It was very amicable. This is not necessarily the norm. I will tell you that I'm also on a committee that is national-based, that is seeking to do a similar thing. And there's much more hesitation to having lawyers participate in any respect in representing the patients. They only see plaintiffs' lawyers as evil obstacles, greedy, who are just out to sabotage the whole program and couldn't possibly be beneficial in any way to the patients. And I'm not exaggerating. That's pretty much how they feel. So Massachusetts gets it. They're doing things the right way. There's a lot involved in this process, and it's overall a fantastic thing because we're hoping it continues to make our healthcare system safer, that it helps clients to resolve cases amicably sooner so they have a feel-good feeling about the result, that there's this hatred doesn't instantly develop between the patient and her physician. And in my one experience so far with that, it really was a storybook ending. The client felt quite happy about having been heard, about having learned what had occurred, and about getting compensation, which she thought was fair given what had happened to her at the time. So anyway, thank you very much.